It is my pleasure now to invite Dr. Rajesh, IFS, Director Niti Aayog COVID-19 Core Team, Department of Health Research, Government of India to share his views on the topic.
And Madam outlined the important aspects and contours of the Act, which is the one which we are currently using along with the other couple of legislations to deal in the current scenario. As you know, COVID-19 is a pandemic of unprecedented nature, and we have been fighting very hard across the country, across the districts, to deal with this pandemic. And as of today, with our efforts, we have done more than like 2,20,000 tests per day. That shows the scale of involvement currently going on in fighting this disease. So it is very clear that it cannot be simply dealt with one single approach. So we needed a multi-stakeholder approach to deal with it. So in this background, let us analyze how Disaster Management Act is helpful to us in dealing with this pandemic. Prior to Disaster Management Act, we had a century-old Epidemics Act, which was enacted in 1893 by the British government to deal with the plague situation in the country. In fact, that was the first act which was invoked by the government authorities, even to deal with the current scenario, especially for regulating the arrivals and departures of international flights and all. The act, particularly the Section 2 of the Epidemic Diseases Act, 1897, was the first instrument that will be used in dealing with this pandemic. Thereafter, it was coupled with the provisions of the Indian Penal Code, particularly 144, to restrict the issue of social spread of the disease. Now, at this moment, let us go back to our statutory books, that is the Constitution. As per the Constitution, health is a state subject. And this issue of COVID-19 is a health issue. So if we use health as a terminology to deal with, then it is largely a matter of health, state government. But it is not ending there. It is such an epidemic, it is crossing the boundaries, it is crossing all profiles of the society. So we needed a larger response to this. So on March 14th, we notified this as a disaster under the Disaster Management Act. So what is the benefit which we can get from Disaster Management Act? Disaster management is put in the concurrent list of the Constitution. So being there in the concurrent list, both central government and state government can very well act on it. So where from this is strength in concurrent list? In our Constitution, we don't have a disaster as very particularly defined. It is relatively silent. But we have entry number 23, which is about the social security and social insurance. That gives strength to this entry, this concurrent list entry of disaster. Secondly, we are deriving strength for Disaster Management Act from entry number 29, which is prevention of extension from one state to another of infections or contagious diseases, pests affecting man, animals, or plants. So the overall ecosystem is clear. We have now an additional level of empowerment, which is the concurrent list subject, which is the disaster management, which has linkages to the entries in the Constitution. So now we have two situations in front. First is health, which is the state subject, and second is the disaster management instrument, which is in the concurrent list. So we are ready now with a complete set of legal instruments for dealing with the situation. So if you just recollect the chronology of invoking of these events, we can understand that on March 11th, the government utilized Epidemic Diseases Act 1897. Then on March 24th, with the declaration of the locking down, we resorted to the Disaster Management Act. Now let's come very closely on Disaster Management Act. What is like very important for us? Disaster Management Act, as Madam specified a little ago, it is a very comprehensive instrument which encompasses rather a complete profiling of institutions from center to district and sub-district. It is ensuring such a level of vertical integration across the country, irrespective of the states and districts, to have a uniform sort of action. At the same time, it doesn't end there. It ensures a horizontal integration also of different departments in the government of India with clear mandates. Rather, it says that every department should have a disaster management plan prepared and integrated with the national plan or even got approved by the concerned state level or district level or even national level. So it is so comprehensive. Perhaps this is the greatest benefit we could derive after our experience with the tsunami in 2004. So in 2005, we got this act, and we have experienced this act over the last 15 years with the different instances of disasters happening in different parts of the country. So we are gained sufficient, and we are utilizing that experience in dealing with this current situation. And we are very much effective as well. That's why even our current test positivity ratio across the country is well within the WHO limits. So, of course, challenge is not over. Still, we are fighting the pandemic. So, we have to continue with this. And at this moment, what is more relevant is to, to give a wider understanding of the provisions of this act to the masses. Because an effective disaster response is happening in three forms. First is prevention, second is mitigation, third is preparedness. So, from these perspectives, maximum emphasis is laid at the district level. If you look at the architecture of the Act, there is a national level disaster management authority, there is a state level disaster management authority, there is a district level disaster management authority also. And what is more beautiful about the Act is that Act itself is providing resources. It identifies resources for implementation of the provisions of the Act, which is not a regular phenomenon found in other acts. They prescribe the directions or policy outlines and leave to the government to identify resources to support. But here, it provides resources also identified through the same piece of legislation to implement the the actions identified under the action plans. And if you look at the core of the implementation area, which is happening in the district, it is so wonderful that a great deal of powers and functions are given to district authority. So as a community, rather at this moment, we can engage with the district community, district authorities at the field to strengthen their efforts, maybe in terms of social distancing, maybe in terms of strict adherence of respiratory etiquettes like wearing masks, or even timely notification of the violators of quarantines. So all these things are small efforts, but it can do a great deal of support to the efforts at the field level to deal with this current challenge. And Madam also mentioned about the role of social engagement of volunteering forces, which is a very clear mandate under the tasks assigned to the district authority. It encourages involvement of NGOs and voluntary social welfare institutions at the grassroots level for disaster management. But then this has to be as per an approved disaster management plan. Otherwise, instead of organized response, there could be chaotic response as well. So, understanding the Act in detail and responding to the pandemic at field level with every sort of evidence-based approach is key now. That is the requirement at the moment in the field because challenges are varying from uh, location to location. Even a particular location could be a sort of a normal area today. Tomorrow it could turn, or in a couple of days, it could turn into a high containment zone. So these are all like very dynamic. So to deal with dynamicity, it is always important that we keep people informed about the provisions and the ways in which they can engage with the act and deliver a good governance of the provisions for service delivery in this field. That will make a significant impact on dealing with this pandemic with the help of all the stakeholders concerned. Now, if we come to the penalties, yes, it prescribes penalties because the Act is not only outlining the responsibilities for different authorities, it also outlines the ways to ensure compliance, even at different levels, right from nation to state. So, if according to the Act, if a person who is not supposed to act is also not acting, is also an offense. At the same time, a person who is directed to respond to a situation in the field under the act, and if he fails, is also responsible. So that way, this act is ensuring a great level of coordinated response to the field. But what we will perhaps miss is this coordination, which is happening between those forced to act and those are ought to act. So that difference, that gap can be bridged by proper social education of the relevant provisions through volunteering, through coordinated, inclusive, local level disaster management plans. With these words, I would like to thank the organizers, IJARSH and the Lexprise for organizing this webinar, particularly on this theme, particularly when we are fighting this evolving pandemic, which is like challenging us in a great way with our resources, our daily lifestyle, even economy. So I wish that every participant here in this webinar will take some clues from this act and engage with whoever is possible to be engaged with in the district or in the sub-district to deal with the pandemic and contribute to control this at the earliest. Thank you so much. Stay safe.
Thank you, sir, for your views on the topic.